Most physios work in outpatient clinics. Most people think that physios are outpatient clinics or in hospitals, but there's more, loads more. Hospitals, clinics, home, oh my. I used to get bored treating the same patients over and over again. I kept changing job settings every 5 or 6 years. That's part of the reason I see physio from a particular point of view. Different places give you different perspective on patient care. Physios fight pain, improve movement, and help with strength, balance, and mobility. But where we do this gets very interesting. The typical medical patient starts in the hospital, in a surgery or through the emergency room. Improve that medical status and the patient gets discharged to rehab. If they can't tolerate the intensity of inpatient rehab, some patients get put in long-term care or subacute rehab as it's called sometimes. Then from these inpatient settings, patients go to home with home care or home with outpatient physio. As the patient outgrows home care or outgrows the clinic, they can be discharged. One trend dominates across all these settings. It's money. Hospital care is expensive, so they push patients to rehab or long-term care or home. Inpatient rehab is expensive, so they push patients to long-term care or home. Staying in long-term care is expensive, so they push patients home or home with home care or to outpatient services as soon as possible. So everything is expensive. Insurance limits coverage, and patients are squeezed between that insurance limitation and the treatment they need to get by. My purpose here is to demystify these diverse settings where physios operate. There's a core majority of physios that will fit into my scheme, but there will always be outliers pushing and pulling the profession in different directions. For example, veterinary physio. I found these pictures on the internet. Check these out. Isn't this wild? I think this is wild. So join me as we explore the exciting world of physiotherapy, human physiotherapy. We can look at these different settings from different sides. There's more than one way to slice this pie. The three major ways to slice up healthcare are by age, like pediatric, geriatric, or adult, or by specialty, like orthopedics, neurology, etc., or by funding. Is it private pay through insurance, or is it a public government funding? Different locations mean you work beside different professionals, and you are competing with other professionals. For example, there are pediatric hospitals, there are inpatient rehab centers that specialize in neurology, and there are outpatient clinics that specialize in sports injuries. But the most basic divide in healthcare is between inpatient versus outpatient. Inpatients have a bed there. That's where they stay. For an inpatient setting, a physiotherapist is likely to work alongside doctors and nurses and personal support workers, occupational therapists, speech-language pathologists, social workers. This is the multidisciplinary clinic idea. For an inpatient setting, physiotherapists don't compete with anyone. But sometimes there's confusion between physiotherapy and occupational therapy. This is an issue of who treats the arm and the hand. Also, cardiac rehab and respiratory therapy are distinct from physio, but there may be some overlap in times to work together on some patients. The elephant in the room here are the chiropractors. Chiropractors are not usually seen as part of the traditional healthcare system, so chiropractors don't work in hospitals. The other side of this inpatient versus outpatient divide are the outpatients. Outpatients live at home. That's where they stay. For an outpatient setting, a physiotherapist is likely to be alone or work with their own little physio team. For an outpatient setting, physiotherapists compete with everyone. Well, clinics compete. This is the marketplace of consumer choice. There are chiropractors, there's athletic trainers, osteopaths, massage trainers. Everyone wants the outpatient dollars. Everyone competes for customers. The exception here is home care. I don't know if any of these other professions are willing to come to a patient's home, so in that respect, physios dominate the home care rehab market. For the inpatient setting, by definition, this is where patient stays there overnight. So even if you're waiting in the emergency room for hours and hours, sleeping on and off, you're still not an inpatient until you're actually admitted. That is to say, until they assign you a bed there. The three major inpatient settings are hospitals, rehab centers, and long-term care. First, hospitals. Hospitals are where you go when you're sick. You usually arrive at the emergency room for triage, or you come in for some surgery. You wait in the waiting room. This is one of those places where people are dying to be at the front of the line. The fundamental role of a hospital is to keep patients alive. And because of costs, they want a short length of stay. So as a rule, they push patients out of inpatient care to cheaper inpatient care someplace else, or to outpatient care. Funding for hospital care is usually some government public funding in most countries, except in the United States because they haven't figured out universal health care coverage. Hey, no judgment. So hospitals try to keep patients alive. The fundamental goal of physiotherapy treatment in the hospital is to regain mobility so that they can safely return home or get out of the hospital. So discharge planning starts when they're admitted. Typical hospital physio patients are post-surgery, post-stroke, post-trauma, and deconditioning. So most hospital physio is getting people moving, early post-surgery motion, and getting patients ready for discharge. When I worked in a hospital, I was coordinating treatment with the occupational therapist. I talked to the nurse and the personal support worker regularly. I talked to the doctor at rounds. I talked to the social worker at discharge planning. For example, the character Bradley was Harrison Ford's physical therapist in the 1991 movie Regarding Henry. Does anybody remember that film? Second, rehab centers. When you're not sick enough for the hospital, but you need too much care to go home, then you need some help getting better. Rehab centers are more intense. Long-term care is less intense, but that's why long-term care is sometimes called subacute rehab. So rehab centers are where you go to get better. Rehab centers can be for physical recovery, like cardiac problems, stroke, trauma, or for mental health recovery, like addiction or psychiatric problems. The fundamental goal of physiotherapy treatment in the rehab center is to regain mobility so they can safely return home or get out of that center. Again, discharge planning starts on admission. For example, to get patients to pass some sort of score on the functional independence measure, this one, or something like the Bartel Index, this one. Funding for inpatient rehab can be publicly funded or private pay, like insurance. Typical inpatient physio rehab patients are post-surgery, post-stroke, post-trauma, and deconditioning. So most rehab physio is getting people moving, complex conditions like spinal cord injuries, post-stroke, post-trauma, and getting patients ready for discharge. We used to do one session in the morning and one physio session in the afternoon. When I worked in rehab, I was coordinating treatment with an occupational therapist. I talked to the nurse and personal support worker regularly, and I talked to the doctor at rounds. Sometimes I talked to the social worker when it came to discharge planning. In a rehab setting, physiotherapists don't compete with anyone. Physios are part of that rehab team. Again, chiropractors are not part of the traditional healthcare system. For example, Helen Mahoney is a character in the 2005 TV movie Warm Springs. As a physical therapist, she treated President Franklin Roosevelt for his polio. Third, long-term care. Long-term care is your home away from home. When you need too much care to be at home, but you're not sick enough to be in the hospital. Like I mentioned, some people are in long-term care for less intense rehab, so-called subacute rehab. Other residents are in long-term care because that's their home, and they need too much care to be independent living at home. Long-term care provides help for its residents. There are different levels of care for residents. Different terms are used in different places. But the two major levels of long-term care are assisted living, where residents get some help, and nursing homes, where residents get lots of help. The fundamental goal of physiotherapy and long-term care is to help residents stay as independent as possible with their daily activities and the mobility. Funding for long-term care can be publicly funded or private pay like insurance. A typical long-term physio patients are geriatric mobility patients. You see some short-term subacute rehab patients depending on where you work. When I worked in long-term care, I was talking to the nurse and personal support worker all the time. Sometimes I talked to the recreation staff to coordinate around their social activities for the residents. I didn't see the occupational therapy much where I was working, except in coordinating equipment needs. Maybe other places use OTs differently. In long-term care, physiotherapists don't compete with anyone. Physios and their team of assistants are the kings and queens of rehab in long-term care. I couldn't find any good popular culture references for physio in long-term care. It's like long-term care doesn't exist in popular culture. Well, there is Abe Simpson, the grandfather character on The Simpsons, but he's mostly known for yelling at clouds. For the outpatient setting, outpatient settings are where a patient goes home at night. The two major outpatient settings are home care and outpatient clinics. First, home care. Home care physio is like food delivery. You call them up, you tell them what you want to eat, and they deliver right to your door. Home care provides care where people live. As an aside, Remote physiotherapy delivered over the phone or over the computer, the telemedicine, is mostly done by outpatient clinics to reach more customers, but it really belongs under the home care setting. Home care is generally underfunded for such technology, and home care physios usually want to actually be in the home, see the patient, and address those safety issues. Outpatient clinics are eager for the business. The fundamental goal of physiotherapy in a home care setting is to help patients regain their ability to live independently, to do everyday activities on their own, and eventually to be discharged from home care. Home care can be publicly funded, or it can be private pay insurance. Typical home care patients lack mobility to get out and go to outpatient clinic. So typical home care physio patients are post-surgery, post-stroke, post-trauma, deconditioning. So most home care physio is getting people moving. When I worked in home care, I was mostly working alone or talking to the personal support worker. Sometimes I'd talk to the nurse or occupational therapist to coordinate care for the patient. In home care, nobody's competing against physiotherapists. Physiotherapists dominate the rehab home care market. For example, Daphne Moon is a physical therapist in the popular sitcom Frasier and was on TV from 1993 to 2004, although the therapy seemed to be an excuse to have a romantic interest in the story. Second, outpatient clinics. Outpatient clinics is an umbrella term that includes more than your typical private outpatient clinic. These are the Starbucks of physiotherapy. There's one in every corner. Most physios in the United States work in outpatient clinics, delivering direct patient care. And there's different flavors of clinics. Remember we talked about the splitting of the pie by age, by specialty, by funding? Which clinics you have depend on the size of your city. Big cities have more niches. In a small town, that one physio has to do it all. I've known physios with very focused patient population. I knew one guy who saw only pelvic floor patients, one guy who saw only headaches, one guy who saw only vestibular patients. Beyond these typical outpatient physio clinics are a range of other physio services. Mostly these are consulting collaboration jobs and education, injury prevention, health promotion jobs. So this might be working at a school, a sports team, corporate industrial setting. The fundamental goal of outpatient physio is to improve motion and improve function so the patient can progress to be discharged. This is where some clinics want patients to be in therapy longer because they have better insurance coverage, but that's not ethical. It's a sign of being financially desperate. I hear of clinics offering unbeatable discounts and limited time offers and join our loyalty program. I know they're struggling. Funding for outpatient physio treatment may be publicly funded, but it's mostly private pay insurance coverage. This is the outpatient consumer marketplace where customers have a choice of where they go. When I worked in outpatient clinic, I was mostly talking to my assistants, my local physio team. In an outpatient physio clinic, physiotherapists often work alongside other healthcare professionals, like an occupational therapist, an exercise therapist, chiropractors, massage therapists. It depends on your clinic. In an outpatient physio clinic, though, physios often compete against this exact same list of professionals. Everyone wants the customers. Many clinics get around this by offering these professions under one roof. Usually the founder is the one profession where it's most important in that clinic and everyone else just has to follow along. For example, you may see a clinic advertised as a chiropractic, physiotherapy, and massage therapy, but really it's a chiropractic office with secondary treatments on the side. I couldn't find any good pop culture examples of outpatient physios who weren't just there as love interests. So do you know of any? Let me know in the comments below. Does all this seem obvious? It wasn't for me working as a physio over the last 30 years. This overview lets you fit in new ideas, like what about direct access or chronic disease management teams through your local health department? Also, what about new professions like kinesiologists? Where does that fit in? This also lets physio adapt to different locations within healthcare, within their scope of practice, like physios working in the emergency department or as part of a local public health department coordinating patient care. Remember any good pop culture references to physios in TV or movies? Yep, let us know in the comments below. Thank you. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Another video for you to chew on right here, and by subscribing, you'll be part of a vibrant community that celebrates everything physio. Thank you.